Hi, my name is Rebecca Winter. Today we are going to be doing an intermediate prenatal flow. This is designed for yogis who have a practice, a strong yoga practice that have been practicing for at least 6 months to a year regularly and are continuing to practice during pregnancy. It's also recommended for those who have a healthy pregnancy and are still and don't have any physical limitations. Now, intermediate for me may be different than intermediate for you. So I'm going to ask you to really be sure to listen to your body. If there are things that we are going through in class that you have not done before, please take it slow and perhaps go to a pose that you know instead. And if you feel like you are much more athletic than what we are doing in today's video, you're also welcome to add to this and ramp it up. So I really encourage you to make this practice your own. So for today's practice, some of the suggested props would be to have at least 2 yoga blocks. I'm sitting on one now, there's one there. 2 nice sized firm bolsters or firm pillows. I've got a comfy cozy blanket to use during Shavasana, and then a thinner blanket or a towel works as well. And I always like to have a strap. We don't always use it, but it's nice to have handy. You can definitely use a belt if you don't have a strap at home. So I'd like you to find a comfortable seated position. That may be easy pose like I am in now, or you're welcome to take this on your knees, especially if you're dealing with some hip pain that might be exacerbated by easy pose. And please go ahead and place something under your sits bones, whether it's a block, a pillow, or a rolled up blanket, so that your hips are above your knees. Great. So find yourself a comfortable seat. And from here, I'd like you to let your eyes close. Now imagine that your hips can really start to sink down into whatever they're on. And as your hips sink, encourage your low back to start to lengthen. And now we're going to imagine that our spine can grow vertebrae by vertebrae. Sometimes it's helpful to imagine that you're walking up your spine, or that you have fingers walking up the back of your spine to help each vertebrae lengthen. So we're going to imagine the vertebrae in the low back lengthening one by one as you grow a little taller. You may find that your natural breath wants to start to deepen here. So I encourage you to deepen that breath by inhaling through the nose and out the mouth with a nice soft jaw. We're going to continue that mental walk up now through the mid-back, lengthening in the mid-back. Coming up into the upper back. Feeling the shoulder blades start to come down the back, drawing together, nice and open in the chest. And if you feel your shoulders are rounding forward, just go ahead and roll them back and down, nice and broad across the collarbones. And we'll continue that mental walk up through the cervical spine, the neck. And you may find as the back of the neck lengthens and the crown of the head reaches towards the sky, that the chin just slightly tucks, giving you nice long length through that whole spine. And from here, I'd like you to place a hand on the heart and a hand on your belly. And we're going to start in on our deorga breathing, full body breath. So as you inhale, you'll let the belly be big and soft. You'll let the ribs open wide, and you'll let the heart and the lungs be as full as they can be. And as you exhale, just let the mouth open, nice soft jaw, as all of the air pours gently out. Continuing in this manner on your own, following your breath, your pace. Noticing what's going on in the body. Perhaps you're far enough along to feel baby moving, both inside and under the hand on your belly. Welcome baby to the practice with you. Allow yourself this time to honor your body, your mind, and connect with the baby growing inside. Nothing to do, nowhere to be, just this. And notice as your thoughts start to lead you around. Perhaps they're feeling places in the body that feel tight or uncomfortable. Perhaps your thoughts are still with what you have to do in your day, things going on in your world. And perhaps the strongest thing is different emotions that are coming up in the body. Let all of these things pass, taking in the information and seeing if you can let it go. Almost like you're taking the dial of a radio and turning that volume a little lower and a little lower with every breath. Good. A few more deep deorga breaths. Beautiful. After your last breath, allow your hands to come back to your thighs. Allow your breath to return to neutral. And don't miss this moment, especially during prenatal yoga. We look to really dive into the pauses. We'll be working hard in our body, but taking that time to get our much needed break. Very similar to how things ebb and flow through pregnancy, and especially through birthing time. On your next inhalation, letting the eyes softly open. Great. And we're going to just warm up the neck a little bit. So inhale nice and tall. Exhale, let the chin drop towards the chest and just start moving the neck around. Some nice circles following your breath. Lovely. And as you're ready, reversing the circle, Wonderful. Beautiful. Inhaling, head comes up, taking some shoulder rolls back. Good. Next, inhale, arms rise, gaze follows. Exhale, twist. Inhale to rise. Exhale to twist. And again, follow your breath. We're going to take a few more twists. Moving with your breath at your pace. Good. One more time each side. Inhale, arms rise. Now interlace fingers, flip the palms, look down and pull the arms back, back, back. Look up, close the mouth, stretching the fascia through the front of the neck and chest. Look down, release the jaw, pulling the arms back. And last time, looking up, closing the jaw. On your next exhale, arms come down. We're going to shake those arms out. Go ahead and remove whatever you're sitting on here. Let the legs come long, shake them out as well. Nice, shake, shake, shake. Wiggle, wiggle, wiggle. Getting that body warmed up. Beautiful. So we're going to come to hands and knees. And I would like you now to grab either your thin blanket or your towel and place it where your knees go. We do more on our knees in prenatal yoga than we do when we're not pregnant. So it can be nice to have a little extra padding under your knees. So go ahead and find your tabletop. Wrists should be nicely under shoulders, knees nicely under hips. And we're going to take it into a cat-cow that follows how your spine wants to move today. So to show the basics on an inhale, we're going to lift the head and the chest, trying not to arch in the low back. We don't need to have a big arch when we're pregnant. As we exhale, we take that nice kitty cat spine. So following your breath and your pace now, I want you to move through cat-cow and start to add in movements that make this fit your body more. So what I mean by that is maybe you want to move a little side to side. Maybe you want to shake and roll your hips more or roll your shoulders more. What I'm going to encourage you to do is let your eyes close and go inward. What feels good to your body today? Great. Keep going. Good. Eventually coming towards stillness and finding your table once more. I'd like you to curl your right toes down on the mat, pressing into the heel. Now we're going to hug baby in as we lift that leg. And when I say hug baby, I'd like you to start using the muscles that wrap around the whole core. So not just our obliques, abdominals, but also all the muscles around the low spine. So we're wrapping all of that in. And then I'd like you to take that right foot and bring it all the way off the left side of the mat and press into that right heel. Nice. Go ahead and look over the left shoulder back towards your toes. Starting to get a nice stretch in that side waist. And then on an inhale, we're going to bring that leg back up, flexing through the foot. Now let's bring the left arm up as well. Nice and long through the spine. looking towards your mat, long through the back of the neck. Great. On your next exhale, lower down. Taking it to the other side, curling the left toes on the mat. We're going to press down into that left heel. Nice and juicy. Good. Inhaling, hug baby as you lift that leg, flexing through the foot. Taking just a moment to feel your muscles kicking in. And then we're going to bring that foot all the way off the right side of the mat, pressing down through the ball of the foot and looking back towards that left foot. Nice deep breaths here, starting to warm up the fascia, the connective tissue in the body. On your next inhale, leg comes along, flexing through that foot. Now bring the right arm up. Beautiful. One more breath. And as we exhale, bringing down the hand and the foot. Next inhale brings up right foot, left arm. And exhale, bringing it down, taking it to the other side, right arm, left foot. Bringing it down. So you can either do that again or we're going to ramp it up a little bit. Inhaling, left arm, right foot. And now we're going to bring that right knee to the outside of the right elbow. And it comes back up. We'll do that 2 more times. On an exhale, knee comes to elbow. Bringing it back up. 1 more time. And back up. Good. 1 more full breath here. And as we exhale, we bring it down. Take a nice little cat spine just for a counter pose. Wiggling those hips. And then finding your table again. So now we're going to inhale, right hand, left foot, flexing through that foot, nice and long. And as you're ready on your next exhale, bringing that left knee to the left elbow. Inhale up. And depending on how far along you are, so we're doing 2 more times here, you may not be able to reach. We're not trying to compress that belly in any way, so just going as far as you can, just working those obliques a little. Great, full breath here. Exhaling to come down, nice cat spine, wiggle those hips, wiggle the head. Nice work. So when we are pregnant, we're thinking about working obliques, working transverse abdominis. Those are great muscles to strengthen to help both with the stability of your core and also during your birthing time. Especially in the 2nd and 3rd trimester, we stay away from strengthening in the rectus abdominis. Those are things that if you're doing crunches or sit-ups would strengthen, because we don't want to open up the rectus abdominis more than they open up just with the growth of a baby. So we're focusing really on the outside, these supporting abdominals. So we're going to go into a little flow here. We can't do, or especially in 2nd and 3rd trimester, we can't do traditional vinyasas, but we're going to get a little movement going. So I want you to bring your hands just a little bit farther forward than you traditionally would doing your tabletop. And these can come a little bit wider as well. And I'm going to have you come back to your knees, so through child's, and rising up on the knees, inhaling, arms rise. Exhale, arms come down, coming into like a table. Coming forward, we're going to do a little push-up. Any amount is fine. Coming back, inhale to rise. Exhale, flow. Inhale forward. Exhale, a little push-up. And coming back and rise. So I want you to follow your breath and your pace as we move through. this little baby vinyasa. Know that you can make any modifications here that work for you. So you might not be feeling those push-ups today, and you don't have to. It's fine to just come forward and go back without the push-up. And you might still be in your first trimester and not be showing and have a ton of energy, in which case you are totally welcome to come forward, come up to plank, and do a more traditional vinyasa there. Great, 2 more times, following your pace, your flow. Maybe that's super duper slow today. Maybe you are feeling really speedy. After the last one, I'd like you to sit back on your heels. Hands are going to come to the heart. And we're just going to pause and take a moment to bring the hand to the heart and a hand to our baby and check back in. Now this is called screaming toes for a reason. It is really nice to open up the fascia on the soles of the feet. But as you're sitting with it, if it starts to become too much at any point, you are welcome to put the tops of your feet down on the mat and sit on your heels. Letting the body breathe big as the pulse slows down. Don't miss this moment. Good. Next, inhale, eyes open. And as we inhale again, arms rise. We're going to exhale, come back to our table. Inhale, lifting the right leg back. We're going to bring that right foot onto the outside of the right hand. So another difference when we're doing prenatal yoga, we're always bringing the foot on the outside of the hand, giving plenty of room for baby. Again, if you are in the first trimester, you're welcome to bring the foot on the inside, but it's not bad practice to get used to this. I'm going to ground down through the left hand. Inhale, right arm high. And now stay here or tuck the left toes straight and through that left leg. Good. Again, stay here. Take that arm, wrap it around the low back, opening through that right collarbone. One more breath. Inhale, arm rises. Exhale, hand and knee come down. Beautiful. Now I'm going to bring my elbow to my knee. You may not need this step if you have a lot of energy. Inhale, arms rise. Exhale, I'm going to lean forward into my hips, trying not to arch in my low back. So think about those hips dropping. Think about the arch coming from the sternum. Letting the arms fall back, thumbs spin out. Good. Inhaling, arms rise. Exhale, hands come on the inside of the leg. Now go ahead and grab a block if you would like them. We're going to get set up for lizard here. So depending on your flexibility and how you're feeling today, you may need the block at different heights, or you may not want a block at all. I'm going to start with my forearms down on the block. I'm going to bring my left knee back just a little bit as I start to lean into the hips. And once I get myself situated, I'm going to also let my head and my neck go. Good. So this can be a challenging pose. We're working on opening hip flexors, and sitting with this discomfort, which is a wonderful mental practice for us as we move through pregnancy and birth. As you feel that fascia, that connective tissue start to give way, you may want to come down a little bit more, but you don't need to push it, especially during pregnancy. We are so stretchy already that we don't need to be always working that edge. One more breath. And then as we inhale, we're going to use our hands to help us rise. Bringing the hands on the inside of the foot. Good. And now we're going to actually bring the foot in just a little to give us some purchase here. So we're going to go into a balance. You can use blocks if you need them. So I will demonstrate with blocks. Make sure that you are nicely balanced here. We're coming into standing split. And you're going to lift that left leg high. That right knee does not need to be locked. And check in with yourself. If you're feeling at all lightheaded, please come down from this. And one more breath. And on your next exhale, we're going to bring that back foot to meet the front and let yourself forward fold, grabbing elbows if that's comfy or any forward fold position that works for you. Letting the head hang. Knees are loose and springy. And now we're going to take 3 of what I call flying flat backs. So as you inhale, arms are going to come wide like a bird, really hugging baby in. Exhale to fold. Inhale, hug baby, fly. Exhale to fold. Last time, your breath, your pace. Good. Now keeping the knees nice and bent. On an inhale, back is going to stay flat as we reach up to the sky. Exhale, hands come down. One hand to the heart, one hand to baby. Now let go in the thighs and the hips. Let go in the belly. Let yourself be balanced by your bones. And we let that pulse start to calm down. Good. Next, inhale, eyes open. So when we're in Tadasana and pregnancy, we often want to keep our feet a little bit wider. So again, if you're in first trimester, that probably doesn't apply to you. But once your belly starts growing, you just want to feel really nice and firm in your base. And this is true for taking poses like chair, which we're about to do. So I want you to find a nice solid base. Feet can be as wide as they need to. And inhale, arms rise. And exhale, we're going to hug baby in as we sit back into our chair. Trying not to arch the low back more than it naturally is. One more breath. You're doing awesome. Inhale, rise. And now exhale, we're going to fold. Good. We're going to step the right foot back, bringing that right knee to the ground. Bring the hands on the inside of the foot. Ground down through the right palm. Inhale, left arm comes high. Stay here or pick that right knee up off the ground. Stay here or wrap the arm around the back, opening more through the shoulders and collarbones. Remember to tap into your breath. Anytime that a pose feels challenging or overwhelming, you always have your breath to help you center. That's also true during birthing. You can always come back to your breath. One more breath. If your arm is wrapped on an inhale, let it rise. And on an exhale, hand and knee come down. Good. If you need to, bringing elbow to the left knee. Before you inhale, arms rise. And exhale, leaning forward into that hip. Making sure that front knee is always behind the toes. If it wants to come forward, let the foot come forward instead. Good. And as I'm leaning forward, I'm going to start to arch through my chest, trying to not arch through my low back. If it feels good, you can bring the arms down, spinning the palms back, thumbs facing back. Open through the chest and the shoulders. Next, inhale, arms rise. And exhale, hands are going to come down on the inside of the foot. So we'll set up for lizard again. So grab your block at whatever height feels comfy. Maybe bring that left foot a bit more forward or scooch the right knee back, whichever works. And you're going to come down either to hands or to forearms, either on the block or your mat. Letting your head and your neck go. And start to tap in to what's going on in that pelvis. During pregnancy, we often take this curled in position. So the front of our hip flexors can get super tight. I know many of you have experienced those little zings of round ligament pain. So poses like lizard can help remind the hip flexor muscles they can grow and lengthen. And as you're hanging out here, if you feel that lengthening happening and you want to come lower, please do. I should note that if you're dealing with any pubic symphysis issues, things like this, you'd want to take it a much shorter stance or skip entirely. Good, one more breath. Nice big one. And on your next inhale, using the hands to help walk you up. Great. And you're going to get your blocks positioned so that you'll be able to get yourself up into standing split. Now for this, as we did on the floor a moment ago, I do recommend actually bringing your left foot in a little bit so that it's nice and strongly rooted. And now you can take it slowly where you're just scooching your right foot forward. Only when you feel like you have a really good base, then you can lift that right leg. Again, listening to your body and checking in. If you're feeling at all lightheaded, you want to go ahead and come out of this. This is such a powerful pose to open up the back of that leg. Good. On your next exhale, back foot meets front foot. Legs are wide enough for plenty of room for baby. And we fold. Taking your favorite forward fold position. Good. Releasing elbows if you're holding them. And we're going to take our 3 flying flat backs. So on an inhale, opening those wings, hugging baby in. Exhale to fold. 2 more, your pace. Beautiful. Now bending through the knees on an inhale, nice flat back as we rise. Exhale, hands come down. We're going to bring a hand to the heart and a hand to baby. . letting everything be calm and still. Good. On an inhale, opening the eyes, bring the palms down to Tadasana. So we're going to do a little bit of a flow here, including some balancing. I'm going to be showing the balancing without a wall. You are very encouraged to use a wall if you want to. Never feel like you're giving anything up to do that. I am trusting you as an intermediate yogi to make the decisions that are right for you when it comes to balance. And you're also welcome to use as many props as you would like. And I will be showing off this balance with blocks. So coming back to the top of your mat, we're going to inhale, arms rise. We're going to sit back in our chair one more time. Hugging baby. Trying to lengthen through the low back as you open through the chest. Good. You can take a Kegel or two here, a little squeeze of the pelvic floor. And next inhale, we rise. We're going to step the left foot back, coming into crescent or warrior one. So you have the option to keep the back heel up or down. And then I'm going to spin my heel down, coming into my warrior two. Flipping the palm, I'm going to reach forward, rainbow back, peaceful warrior. I like to grab my belly here, feeling baby practice with me. Inhale, warrior two. Now we're going to come into a side angle. So if you would like to have a block, you're welcome to. I'm going to bring my hand down, bringing my left foot up. And working this pose as it's appropriate for me. So for me, I can lift my gaze, but you may want to keep your gaze looking down. And on your next exhale, trying to float back into warrior two. Maybe today you float, maybe you don't. So then I'm going to take my parallel feet, opening wide. And as I exhale, I'm going to cross right arm under left, bringing my heels in a little and flowing back and forth. Inhale, open out, five-pointed star. Exhale, left elbow under right, and flow. Good. We're going to do a little bit of squat work with our pelvic floor work. So we inhale, open up. As I exhale, I'm going to come down, bringing my hands together. Inhale, arms rise. Exhale, come down. Inhale, arms rise. Let's bring in some of the pelvic floor work here. So as I inhale, I'm going to tighten my pelvic floor. And as I exhale, I release. Inhale, tightening my pelvic floor. Exhale, release. Good. Two more times. Last time. Good. You may want to bring a block to the back of your mat now. So now we're going to point our left toes, bringing our back toes into our 45-degree angle. And we're going to come down into our warrior two here. Flipping the front palm. We reach forward, rainbow up, peaceful warrior. Inhaling warrior two. And then as slowly as you need to, finding your balance on this side. Beautiful. Giving yourself time and space here. It's yoga practice, not yoga perfect. Just be amazed what your body can do today. As you're ready, you'll flow out, finding your warrior two. Coming into warrior one or crescent. And then stepping forward, exhaling, nice forward fold. Good, let yourself hang. You're doing it, mama. Good, 3 of your flying flat backs. Your pace, your breath. Wonderful. On an inhale, we rise flat back. Exhale, hands through heart center. One hand to the heart, one hand to baby. Releasing the thighs, releasing the hips, releasing the belly. Feeling that prana, that energy moving through you and baby. Using those big breaths to slow down. Gorgeous. So from here, I would like you to find the flow that feels best for you to come into pigeon on your right hand side. So this is where that intermediate kicks in. I want you to decide how you'd like to flow to get there. Moving your body the way that feels good. And when you find your pigeon really settling in, we're going to start with king pigeon where we're still up, making sure there's plenty of room for your belly. And making sure you take a nice deep inhale at the top. Exhaling to come down. Maybe you want to put hands or head on a block. Maybe you can come all the way down. Letting things start to settle. Really going inward here. What can you let go of? One more full breath. And on an inhale, rising. If it's still possible for you, we're going to take the left leg. We're going to cradle it in our elbows. So depending on how big baby is right now, this might not work. But if it does, go ahead and rock that leg side to side, opening up through the hip. Good. And then reversing, so left leg is going to come forward, right leg is going to come back. Again, really take your time to set up first in king pigeon. Nice and upright. That's another really nice way to get that front hip flexor opened up too, and make sure there's plenty of room for baby. And then as you're ready, you can come on down. Really trying to let go, not just in the body, but also in the mind, also in the emotions. One more breath. As you inhale, coming up and rocking that leg. Good. I want you to go ahead and remove the blanket or towel that was on your mat. We're going to grab a block. We're going to do a really quick inversion here before we find our Shavasana. So coming down to your back, bring the heels close to your buttocks as if you're going to set up for bridge. We're going to choose the yoga block height that's right for you. So you do have your small, your medium, and your high. And as you're ready, you're going to press through the feet to inhale the hips up, placing that block at a height that feels good. You should feel nice and supported through your sacrum. If you don't have a block, it's okay to use a firm pillow here as long as you feel well supported. I'm going to bring my arms down, palms face up. And then inhaling one leg and then the next, coming on up. You're also welcome to do legs up the wall here if that's a little more accessible for you. You just want to get some weight off the legs, letting the blood and the lymph pour down. These inversions are also so lovely, getting baby off the hips for a little bit. And they can really help baby find an optimal position for birthing. So you're welcome to stay here and be still. Or if you still feel like you have some wiggles to get out, you can go ahead and start to flow the legs, flowing however feels yummy for you today. So splits, bicycle legs, helicopter. You can even bring the soles of the feet together, opening the knees like a bound ankle. Try to go inward now and flow. Eventually move back to stillness as we take a few last breaths, letting the body settle back down. Good. As you're ready, you'll exhale one foot down and then the other. When the feet are firmly on the floor, inhaling hips up and removing your block. So from here, if you feel you need any more poses before Shavasana, please listen to your body and go ahead and take them. I'm going to set up for Shavasana. Your options are you can do it side lying on either the left or the right side, as long as you have all the yummy bolsters to support you. I'm going to showcase a way to do it reclined that is safe during pregnancy. So I'm placing my yoga block underneath one of my bolsters or firm pillows. I'm going to take my other bolster and place it underneath my knees. You can also use a rolled up towel for that. And then I'm going to get my nice cozy blanket and put it over my body. Wherever you choose to have your Shavasana, please try to have all the props to make you as comfy as possible. If there was ever a time for you to be cared for and feel like you have all the luxury in the world, it would be during pregnancy. When you find your Shavasana, give your body permission to start to release. Release the body. Release the mind. Release the emotion. Let your whole head release down. Eyes float in their sockets. Jaw is loose, allowing the teeth to separate and the tongue to float in the mouth. All expression falls from the face. Releasing in the back of the head, down through the neck, down through the shoulder, down through the arms, the hands, the fingers. Releasing the weight of the back body, upper, middle, lower back. Releasing in the chest, the sternum and solar plexus, the ribs, all the way down through the belly. Nice soft belly, plenty of space for baby. Releasing in the hips, the pelvis, the buttocks. Releasing down through the legs, through the knees and calves, through the ankles. Releasing the tops and soles of the feet and every toe. Surrender the whole body. Know that your body and your baby are healthy and strong. You are safe here. Let go. Feel free to stay here as long as you'd like. If you'd like to follow me, allow your breath to deepen. Feeling baby, maybe wiggling or sleeping. Allow your fingers and your toes to wiggle, wrists and ankles. Maybe taking a full body stretch if that feels right. And as slowly as you need to, taking the time to care for yourself. Find how you would like to come up to your comfortable seat. Again, propping something under the hips if that's easy. When you get to your seat, allow a hand to come to the heart and a hand to come to your baby. Don't miss this moment. Feeling that connection, whether or not you're at a point in pregnancy when you can feel baby move, knowing that they're there, they're breathing with you, their heart is beating as yours is beating. See if there's anything that's still calling to you in your body that you'd like to let go of, whether it's physical, mental, or emotional. And I invite you to let go through breath. So on your next inhale, take a nice deep breath through the nose, out the mouth, let go. Bringing hands together at heart center, thumbs graze sternum, we'll lightly bow the head. We give gratitude to ourselves for taking this time to honor our bodies and celebrate our babies growing inside. By caring for ourselves, we can be more caring and loving to those around us. Lifting the gaze, we thank each other with a namaste. Thank you so much for joining me in this practice today. I hope you have a relaxing and lovely rest of your day or night. Namaste.